no-brainer that any nation the size of India needs to spend on its healthcare. Unfortunately, that hasn't been true all of these years. In fact, on an average over the last several years, we have spent or allocated actually just about 1% of our GDP on healthcare in every budget. Will this budget be different? Is there a choice apart from it being different? Have we learnt our lessons? These are the big questions that face us as Budget 2021 kicks off and the countdown kicks off in the year of the pandemic. We're still going through COVID-19. The Finance Minister Nirmala Sitharaman has to eke out funds for a huge vaccination drive that depends on how many people the Indian government wants to vaccinate for free and who will really pay for it. But apart from just vaccines, there are several issues that we face. As per recent reports, India has the fourth lowest spend on healthcare as a proportion to GDP. We have just 5.5 beds, hospital beds per 10,000 people. The number of doctors per people is also abysmally low. We need to fix all of this. Can we do it this time round? To speak on this, I'm joined today by Dr. Ashutosh Raghuvanshi, CEO and MD of Fortis Healthcare. Professor K. Srinath Reddy, President of PHFI, joins us on the show, as does K. Sujatha Rao, former Health Secretary. Also pleased to welcome on the show today Dr. Arvinder Soin, Chairman of the Medanta Liver Institute. Welcome to all of you and thank you for speaking with us today. Dr. Raghuvanshi, let me start with your take on Budget 2021 and healthcare. I mean, there's some hope that we will increase our allocation to maybe 1.5% of GDP this time round. The Health Ministry, we learn, wants close to 65,000 crores just for vaccinations. In your view, what should be the priority?
So obviously, because of the pandemic situation, vaccine is a priority for the government, and that's what it should be. Other than that, there are several other factors which are important. Pandemic has brought into light a lot of systemic inadequacies which we have, which we were all aware of, but they're glaring at us. And it is important that some of those factors at least are addressed in the short term. But I think the biggest priority should be vaccination.
You know, there is a lot of different points of view on should the vaccine be free for all. Professor Reddy, I'd like you to come in on this. And ahead in the show, we'll talk a bit about the funds required, where does it come from, what the math is, the budgetary math. But on the basic question, because that will really determine everything. Should all 30 crore in phase 1 be vaccinated for free? Should the entire 70% of the population to achieve herd immunity be vaccinated for free? Should the vaccines be paid for by those who can afford it, maybe at a higher cost to subsidize the rest? What is the kind of formula you think would work?
Well, basically, when you look at the vaccination as a function of public health, and we even borrow the terminology of the economists that this is a public good. In an epidemic situation, vaccinating a person means also you're protecting many others from being infected by that person. Therefore, the benefits are not restricted to that individual alone, to the family, to neighbors, to co-workers, and a number of others. So it is absolutely essential that public financing backs that vaccination drive. Now, how that is going to be done in terms of tax-funded financing has to be seen, but you could actually mobilize other resources as well, which the government can access. But nevertheless, I believe that vaccination should be made available both to the essential workers as well as to the vulnerable sections of the people, so that every one of them is adequately protected, and it should not be left to chance or to affordability issues. And further, I believe that these resources must be mobilized from outside of the traditional health budget, whether it is for this or for the diagnostic services to trace the new mutants. All of that has to be an additional budget, because our commitment to meet the goals of the National Health Policy of 2017, as well as the Sustainable Development Goals of 2030, cannot be further impeded by the diversion of the funds from the traditional health budget. So you need to have our traditional health budget also increased to meet the many unmet demands of the health system. At the same time, mobilize additional resources to meet the COVID pandemic related demands, which are currently also important.
This total spending which is being expected in FY21 could be 64,300 crore rupees. Now, if you add the vaccination rollout into this, cost of vaccines plus the administration, transportation cost, nothing else really would be achieved this year. Sujatha Rao, what in your view are the largest challenges right now? Is it simply the basic logic and theory that, India is such a large country, doesn't have the funds to do this? Is that our problem, or is it a lack of will of focusing more funds towards healthcare?
It's a bit of both, I would say, that we do have a lot of competing demands. There's no doubt that other sectors, say, for example, education is again a sector which really needs high priority attention, and that also means a lot of resources. So there is, in a country like ours, with teeming populations, there is a huge amount of sectors and competing with each other for funding. So, and then our own tax to GDP resource base is not really appreciably increasing. And whatever we had has also been badly hit by the pandemic. So we are in an extremely fragile situation insofar as budgetary resources are concerned. And to resort on, say, additional cesses or mopping up more money from the public is also again constrained because economically almost every section of our society has been badly hit by the pandemic. That's one side. But the second side is traditionally political will and political support for health has always been very low, as is expressed most by the fact that they've never increased more than 1% of GDP allocations for public investment in health. And I say this because even during good times, when we had almost a two-digit growth, we didn't, but 10%, 9% growth, we didn't increase very much the allocation for health, much more than 1.2 or 1.3 of GDP. So I think there is both a mix of political will as well as these demands for a lot of other sectors demands on public resources. So, but then at the same time now, we don't have much of a choice, I feel. The flexibility isn't there. We just have to move in. And as Dr. Reddy and Ashutosh have said, we have no choice but to provide vaccines as a public good for the vulnerable sections, because the social benefits far outweigh than what would be the cost if we ignored vaccination and made it available only for those who can afford to pay for it. So therefore, the vaccination is going to be a big draw on a already very thin budget line for health. And secondly, we also have to invest equally quickly on the infrastructure. As Ashutosh had mentioned, the huge infrastructure gaps, which we saw glaring in the way we could, in our response to the pandemic, and that cannot brook any more further delay. Yeah. We just need to find the money to make the required capital investments for both increasing the public health capacity, both in terms of infrastructure as well as human resources. This cannot be postponed. And I think it's a fine balance that the government will have to meet between making new investments for improving our public health capacity, vaccination to give us a solid response to the epidemic, and third, to improve and sustain our ongoing activities such as TB control is something that we cannot either postpone. So there will be some amount of reordering that the budgets that they might have to do. So it's a very
reordering for sure, but is that going to be enough? Dr. Soin, I of course want to get your view on whether the vaccines should be universally free or should people pay for them, those that can afford to, and I'm sure you'll talk about that. But I also want to point out the sort of lopsided and very huge part that the private healthcare sector plays in the lives of Indians' healthcare needs. I mean, on an average, 70% of healthcare needs are met from out of pocket for Indians. We already know that for several families in India, a major healthcare scare or tragedy would impoverish the entire family. And the government services are minuscule, or they're not enough. The quality is suspect, people don't trust it sometimes. All of those endemic issues are there. Isn't this a good opportunity to look at some of those issues as well?
Well, actually, they've been lying on the back burner for too long, and you're absolutely right. Those things need to be amended as well. Specifically, out-of-pocket expenses become prohibitive for most people. Actually, if there is a complex issue with, there's a heart issue, liver issue, kidney issue that takes 15, 20 days of hospitalization, maybe a procedure. I mean, the expenses are unaffordable for most people don't even have access to these procedures. So I think what needs to be done is universal health insurance. The insurance got to come in a big way, whether it's private insurance, government-fueled insurance, or the employer-based insurance. So that is one way that you can actually take away people's burden of out-of-pocket expenses. So that's something that should happen. And the climate should be made conducive to that. And I do want to touch upon the free vaccine issue. And I think that COVID care has not been free, has it? I mean, COVID medicines have not been free, admissions have not been free, although government has actually capped the prices that the private hospitals can charge, but people have had to pay for it. So whether you actually call it a COVID cess or a vaccination cess, or some kind of a special health cess, or you ask people who can afford it to actually pay for their vaccines, I don't think the government can actually take the burden of free vaccination in this country. That's for sure. Ideal as it might be.
You want to come in on that? I just want to speak. Yes, I want to just speak a little bit more about how vaccinations are going to roll out. Now, this is a sort of a catch-22 situation because once people who can afford it go out and start paying for them, the fear is that they may corner the vaccines and may jump the queue, so to speak, and get vaccinated first. On the other hand, if you don't have people who can afford to pay for it, would it be fair in a country which has such a vast inequality?
So you're asking me, right? So the thing is that obviously there has to be rationing.
Professor Reddy, I want Professor Reddy's response to this.
Well, basically, the government has identified two groups for initial vaccination. One is on essentiality criterion, that essential workers, whether in health or other areas of essential work, should not get sidelined and incapacitated because they fall ill, because then many services will start failing. The second, of course, is that people who are vulnerable in terms of getting severe disease or even potentially dying should be protected because they are vulnerable because of age or associated health conditions called comorbidities. So in some cases, these overlap. Health workers are both essential and vulnerable. Now, it is absolutely essential that public funding should take care of these functions. Later on, when other sections are to be immunized, then you can look at what the options are based on the resources available. But at least in terms of these two, in terms of protecting these two critical groups, it's absolutely essential. But I would like also to say that these funds would have to be mobilized from other sources and not by dipping into the health budget, because there are so many other priorities of the health sector that need to be met as well. The whole area of primary health care, urban and rural, urban health mission has really not rolled off. And that is critical even in a pandemic situation. We need to double the number of ASHAs and auxiliary nurse midwives. We need to bring in more male multipurpose health workers. We need to upgrade our district hospitals. We need to bring in telemedicine. We need to actually extend the Pradhan Mantri Jan Arogya Yojana by including OPD care and essential drugs and diagnostics. And all of this requires the budget also to rise. And unless the center sets an example by increasing its own budgetary allocation, the states are not going to follow suit. And if we really want to reach the goal of 2.5% of GDP by 2025, we must recognize that the center contributes only 1/3 and the states contribute 2/3. Therefore, the center should set the example to the states so that the states also in their own budgets can start increasing their health allocations.
Absolutely. Can we wait? Sujatha Rao, let me take this question to you. Can we wait till 2025 anymore for this plan to allocate 2.5% of the GDP to healthcare? Several experts around the world have warned that COVID-19 may not be the last pandemic, that frequencies of these kind of diseases may spread. We don't really know what we're staring at. And the entire healthcare system was exposed for its fault lines here.
Absolutely, I agree with you. And 2025 is just too far away. I mean, the amount we have lost on account of the pandemic, at least now we should, our policy makers must realize the importance and centrality of health. That you don't invest and ignore and neglect health, then you have a much bigger price that you will be paying in the long and in the short run, whether in terms of quality of life or whether in terms of actual economic growth. So, they just, it is, as I said, the resource base of the government, I understand, is the options to maneuver and shift more funding for health is a problem, maybe, but they have to make those choices. They may have to cut on a few subsidies. They may have to give up certain expenditures in non-essential areas, but they have to focus on health. I don't think that option is there. And they have to increase at least double the health budget right now. Now, the problem, the issue is that World Bank, ADB are also coming along. They've offered $1 billion right away. So, maybe we can even depend on external funding, but how much of it will be, there's a whole complicated formula for its funding basis and how much of it will be have to be repaid by the central government and so on and so forth. Those final details have to be worked out. But as what Dr. Reddy said, the liquidity with the state governments to really be able to push up their budgets for health is really critical, and that needs to be done. That means that they might have to reprioritize on the existing set of programs that they are implementing towards building a public health capacity. So a reprioritization of the existing funding and also trying and seeing a very tight targeting of where the money has to be spent. So this business of public-private partnership, for example, may have to be held on hold. There's several other areas in which maybe, after all, for example, Tamanna, I'll take a minute. Thailand, from 1995 to 2000, they focused the entire budget of theirs on building public health capacity, on improving the public health infrastructure. That then enabled them in 2002 to declare a universal health coverage program for their people. So unless there is that kind of political will to say that we will build our public health capacity, I don't think this kind of, saying private sector, incentivize that, and halfway measures that we've been doing will really help. So I don't think we can postpone the target, and there has to be a much greater call for increasing the budgets overall for health. Otherwise, we have it's a very difficult situation. Forget another pandemic. I hope we don't get another second wave of the same pandemic. We don't know. The future is so uncertain, and we need to be prepared for that.
Yeah, we've in that sense been relatively less harmed because of maybe herd immunity or whatever factors. The infections have gone down right now. But what if it were worse? We have to be prepared for worst case scenario. Dr. Raghuvanshi, I want to come to you on the real challenge, which is not only allocation. It is also spending. And government after government finds it difficult to actually go ahead and disburse that money that they have allocated, do something about it and use it properly so it reaches the stated purpose. That efficiency, you think, will be a challenge, and is there something that the private sector can do in this regard?
There's inefficiencies which have been there. I think they are not specific to just healthcare, but that's something which is, endemic to everything we do in this country. Unfortunately, that's the fact. Now, private healthcare sector, in my view, cannot replace the public healthcare sector in a country like India, which is so resource constrained. People have economic problems and issues. So private healthcare cannot be a substitute for public healthcare. It can at all be only a complementary thing to the public system. And for that reason, I believe that public healthcare can only be run through the government means, and the private sector can contribute in very limited ways in some specific programs or in some specific delivery of services. So there is an entire ecosystem of health, right from prevention to the urban centers and a lot of other measures which Professor Reddy mentioned. I think those are the key for a country such as India. And private healthcare is just a provider of certain elements of that service, certain elements of that supply chain. So we have a private sector which is very vibrant, which is very innovative, and which can scale up, provided they are used as such. They should not be used as a substitute of the public healthcare system. And I think that is the most important factor to be considered. Private health systems cannot support the disbursement of funds, for example, in a more appropriate and efficient manner, for sure. And I think those are the things which the policymakers have to think about.
No, but when I say the private sector's involvement, of course, disbursement of funds, the governments have to do. But what I mean is the stark contrast, the kind of expertise we have in the private healthcare sector in India, some of the best doctors in the world, some of the best facilities in the world, at sometimes rates that most Indians cannot really pay. But can that expertise be used somehow? Dr. Soin, I want to come to you with that point in terms of what we can really do. We've identified the problems. We know that money is not enough to go around to address all of those issues. But can we cleverly think of ways to quickly improve the level of healthcare that the average Indian right now has access to?
I have a very simple suggestion for this. There are lots of people in the private sector who've all been to good medical schools, who've been teachers and professors, and perhaps then branched off into private medicine. And I think their expertise and teaching abilities should be used in producing good quality doctors and specialists. That's one very simple area that the private healthcare people can actually help. So if you're saying that we're not utilizing healthcare services as they should at the primary and secondary level, even tertiary level, because there aren't enough doctors or enough nurses or enough well-equipped centers. For example, in the COVID pandemic, something that came forth was that there are 40,000 ventilators in the public system that are lying unutilized because there weren't enough personnel, ICU personnel, to actually operate them. Now, it is entirely possible for an e-ICU system and even physical training of government doctors by private centers to actually enable them to gainfully use those equipments and facilities that are actually lying unused. So that's just one example how private healthcare systems can help. But like Ashutosh said, we actually fit into a plan. We cannot be the plan. The plan has to be public, obviously, healthcare system, and private healthcare can be used to supplement and complement that. And one area is training good doctors. I'm sure that we can actually pitch in there.
Absolutely. That's a great suggestion, really. Hope it's taken on board. We've been promised a budget that has never been seen before in the last 100 years. Maybe this is the twist that we can hope for. Huge allocation for healthcare with a clear plan on how to use that money. Thank you so much to all of you for joining us on this discussion today.